Sulconazole is a medication used to treat skin infections such as athlete's foot, jock itch, ringworm, and a skin condition called pityriasis, tinea versicolor. Pityriasis is a fungal infection that causes the skin on the neck, chest, arms, or legs to lighten or darken. Sulconazole is an antifungal that works by stopping the growth of fungus. It is applied as a topical cream and is typically used once or twice a day, as directed by a healthcare professional. It is important to apply the cream to clean, dry skin and to continue using it for the full prescribed length of time, even if symptoms improve. It is best to use it at the same time each day to help remember. If the condition does not improve after using sulconazole for the prescribed time, it is important to consult a healthcare professional for further evaluation. When using sulconazole 1% topical cream antifungals, it's important to only apply it to the skin. Make sure the area is clean and dry before applying the cream. Your doctor will tell you how often to apply it, usually once or twice a day. The amount of cream and how long you need to use it will depend on the type of infection you have. It's important not to use more than prescribed, as it won't make your condition clear up faster and may increase side effects. Apply enough cream to cover the affected area and some of the surrounding skin, then wash your hands. Don't cover the area unless your doctor tells you to. Avoid applying the cream in your eyes, nose, mouth, or vagina. For the best results, use this medication at the same time each day and continue using it until the full prescribed amount is finished, even if your symptoms improve before then. If your condition persists after 4 to 6 weeks of treatment or gets worse at any time, be sure to inform your doctor. Some common side effects of using sulconazole 1% topical cream antifungal may include burning, stinging, swelling, irritation, redness, pimple-like bumps, tenderness, or flaking of the treated skin. If any of these effects persist or worsen, it is important to notify your doctor or pharmacist promptly. However, many people using this medication do not experience serious side effects. It is important to inform your doctor immediately if you experience any serious side effects, such as blistering, oozing, or open sores. While a serious allergic reaction to this drug is rare, seek medical help right away if you notice any symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. Keep in mind that this is not a complete list of possible side effects. If you notice any other effects not listed here, it is advisable to contact your doctor or pharmacist. Remember, this medication has been prescribed because your doctor has determined that the benefit to you outweighs the risk of side effects. In terms of daily dosage, it is important to apply a thin layer of this medication to the affected area as directed by your doctor, usually once or twice a day. It is best to use this medication at the same time every day to help you remember. Follow your doctor's instructions carefully and do not use this medication more often or for a longer time than prescribed. If you are in the US, you can call your doctor for medical advice about side effects, or report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects, or report side effects to Health Canada at 1-866-234-2345. Before using sulconazole, it's important to let your doctor or pharmacist know if you have any allergies to sulconazole or other azole antifungals. Also, make sure to inform them about your medical history and all the products you are currently using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, only use this medication if it is clearly needed and discuss the risks and benefits with your doctor. If you are breastfeeding, consult your doctor before using this medication. When using sulconazole 1% topical cream antifungals, it's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. Remember to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Always consult your doctor before starting, stopping, or changing the dosage of any medicines. If this medication is swallowed, it can be harmful. If someone takes too much and experiences severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the US, you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center for assistance. It's important not to share this medication with others. This medication has been prescribed specifically for your current condition, so it's not recommended to use it for another infection unless your doctor advises you to do so. If you're using this medication to treat pityriasis, it's important to note that it may not cause an immediate return to normal skin color. It may take several months after the treatment is completed for your natural skin color to return. If you forget to use a dose of sulconazole 1% topical cream antifungals, apply it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and use the next one at your regular time. Don't use double the amount to make up for the missed dose. Make sure to store sulconazole 1% topical cream antifungals at room temperature and keep it away from high heat. It's important to keep all medications out of reach of children and pets. When it comes to getting rid of this product, make sure to properly discard it when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to dispose of it. Remember, do not flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.